Information communication technology is the means by which you obtain information, you store, you retrieve, and you utilize that same information for your own good.
Good day, viewers. My name is Aondo-verr Agnes. I'm a student of Benue State University, Makurdi, Department of Mass Communication. I'm here to do a film documentary with my group members on the effects of information communication technology, ICT, on the health sector. Please stay tuned and go nowhere. Thank you. Information communication technologies, ICTs, embody all digital technologies that supports the electronic capture, storage, processing, and exchange of information in order to promote health, prevent illness, treat diseases, manage chronic illness, and so on. In the health sector, ICT is referred to as a set of projects or services that allow for remote care, telehealth, interdisciplinary clinical support, as well as knowledge transfer.
Good morning, sir.
Good morning.
May we know you, please?
I am Dr. Obatomi David Olayinka.
Okay.
Nice meeting you.
Same here, sir. So we are students of Benue State University. We are here to probably get your take on how ICT, information communication technology, has been helpful to the health institution, sir. So I just have a few questions for you here that we actually just want answers to, sir.
You're welcome.
Like, what is ICT and why is it important to the health sector?
Information communication technology is the means by which you obtain information,
Okay.
you store, you retrieve, and you utilize that same information for your own good. And we see the way other institutions are using it. And it kind of saves them time and cost. It's much faster to retrieve information rather than going through the analog method. So the hospital looked into it for the reason of cutting patients' waiting time over retrieval of information and the utilization of such information.
Okay. Thank you very much. So, with what you just said, I'm being pushed or forced to ask how they are being used in the health sector.
Okay.
In what departments, in what various departments are they being used in the health institution?
In this institution, Madonna Hospital,
Okay.
for example, we capture the information of the patient at the point of arrival to make sure we get their biodata, all their biometrics.
Okay.
Everything is installed, including their pictures. So when we do that, for those who are willing to leave their pictures, it is unique. You have a unique identification number, and it's much easier for us to retrieve that information anytime you are back. So that same information cuts across board. On a single platform, it will display in front of the doctors,
Okay.
on their desk. It will display in the offices, at the lab, at the pharmacy, on the ward. It will only show on the ward if the person is being admitted. The information pertaining to only the pharmacist will appear in the pharmacy.
Oh.
The one pertaining to the laboratory will appear only in the lab. The one pertaining to NHIS will appear only in the NHIS office, such that patient information or confidentiality is maintained with the doctor only. That is the way it cuts across board. Then when the patient is admitted, more platforms opens on the ward so that the nurses can chat and do all of it.
Okay, sir. In what way has ICT positively or negatively affected medical activities and health services in the hospital?
Interesting. In terms of the impact of ICT in the hospital, the way it has helped is such that prior to now, we have to do a lot of heavy documentation because we have clients that are registered on insurance, NHIS. So that means when the client comes in and they capture the client's biometrics and they bring the client in to you as a doc, you have to, first of all, go through series of paperwork. Then you document on the sheet that is meant to see the patient on the outpatient basis. If the patient were to be admitted, you now fill a form, a request form, send it to NHIS to find out, will you let me admit this patient under this diagnosis, or should I not admit? Is this diagnosis secondary or primary? You wait, then when they give you the reply, you now get another sheet and begin to transfer the first documentation for outpatient, you transfer it into the inpatient, so that the document for outpatient is there, it's not mixed up with the admission documentation. Admission documentation assists the nurses to know and have their own record on the way. Once you write that, you now write treatment sheet as well for the patient. Then you fill in all the vital sign sheets. So you are doing like up to 5 or 6 paperwork just to admit one person. It's laborious and time consuming. And in a day, sometimes you might have to attend to more than 100 patients. So you work more. But with the introduction of the ICT, it lumped all of those processes into just one. The patient goes there, they capture the biometrics, the triad nurse sees the patient and imputes the patient's vital signs, which, when done subsequently, shows as a graph. The more they add, the more you see the graph. And then you can have a holistic, circumspective view of the different vital signs. When the temperature changes, you might look at the corresponding blood pressure. You might look at the corresponding weight of the patient, the corresponding BMI, different things you are seeing together for you to be able to give holistic management. So when it lumps all of that together and the patient comes into it, you already know the patient's name, you have the patient's contact, everything, and then you can document by just simply typing a few clicks. You get your documentation, and it helps you to organize your work because it gives you different subheadings. The history, the physical examination, everything you need to do is there. The diagnosis of them are based on International Classification of Disease, ICD-10. So everything is standardized. Anywhere in the world, the diagnosis you are giving is not arbitrary. It cuts across board, so it helps you do your job. By the time you are through with that patient, before you know it, even if you are admitting the patient, you don't have to repeat. By the time you are admitting the patient, all you need to do is just to click a single button on the system. It says request for admission, then you click on it, and the patient is admitted. The next thing you need to do is just enter or impute all the medications that the patient is going to get, and that's it. So it cuts patients' waiting time. It reduces the heavy burden on the doctor, and it also reduces, it even takes out entirely the need for paperwork. So you don't have to look for someone out there who runs a printing press to keep, charging you, and then you are printing different papers and cards. Those ones are out of the way. So it cuts cost, it saves time, it's more organized, and it gives confidence because when you come back as a patient subsequently, your information is there. Even if you forget your hand card at home, just your name imputed, the system knows out your information. So it is safe, and we have backup to make sure that these things are there. So that is the way it has helped us so far.
Okay, thank you very much, sir.
So in my own take, I think ICT, if a private hospital like Madonna Hospital could set it up, and we have seen the clear advantage of using it, it's something I would recommend to any institution, because we live in the age of information and we will always have to get more information, new information, store this information and retrieve them in a way that breeds confidence. We are using that here. It's cutting time, patient waiting time. It's reducing workload. It's also cutting overhead of running the hospital because it saves you a lot of the need to print and all the bureaucracy that might come with that is cut off. We have a standby journey in case if the JED supply of electricity is not enough to power it, there is a standby jar, and we even have inverters to make sure that there is consistent supply of electricity, which will have been a downside of it. We always have electricity to come with. It's something I would recommend. Even in the school, they can use this in different departments. It allows you to post, like for example now in the radiology department, instead of you printing films each time a radiograph is taken, instead of you printing film and wasting money on buying films, you can actually send a soft copy of the image on the EMR. And the doctor here is already seeing it. The patients don't have to carry files, folders around. No. Once you send them to the lab is already aware that the patient is coming, and the test to run, they're already there. You go to the cashier. This bargaining, your test, can I pay 2,000, 5,000? No, everything is already computerized. No cheating. We are not cheating you, are not being surcharged. You get it. Everything is standardized. So I really recommend this to any organization who wants to use such, that it's really here to stay and it is functional. Something else.
Okay, sir, I want to know the reaction of your patients when most of these machines are used on them, how they react, how they cope, their expressions, what they say and everything. We just want to know basically how they react to the machines.
Thank you. I get to see that every day, particularly when you have a new client coming in who is not aware of what is on ground. When they come in and you examine and you make your documentation, and then you tell the patient, I would like you to run A or B test. Say, so you proceed this way. When you get out there, tell my attendants that you want to see the cashier. Then you go to the lab. Some of them, they remain seated. Then I said, look, you can go. And they ask me, won't you give me anything, as in, you get this sort of, as in, when I get there, what will I present for them to know that this is what I ought to do? Just tell them, don't worry, they are where you are coming already. And they're like, wow, in a private setting, I like this. So as they step out and they get to the cashier, she's already aware. She tells them how much they're paying, they pay, and then they get to the lab, and the lab manager asks you to sit down, takes the necessary samples from you. And you can imagine again when they tell them at the lab that go to your doctor, the result is there, and they come in. Some of them, sometimes they may request a printout of their result from the lab, and the lab man hands it over to them. They walk in here, they are giving you the result, and you say, no, I already see it is there. That's your copy. Do you know the way they feel? There's this, wow, I'll bring my family here, I'll bring in a friend, no, this is nice, I just love this. Some of them even tip you, say, no, I like your hospital. Some go to the CEO and tell the CEO that this is something, they express their gratitude. Others write gratitude letters and then give to the CEO to show that we are doing something nice here. And that's why I said I can recommend that. Do you know what it means when you come back like 2-3 years and all the vital signs ever taken for you, I just do a few clicks, and then I open the system, and you're able to see whether you are adding weight. When you lost weight, you can see the corresponding vital signs all over. It makes you know that you are being monitored. It's not as if you are just being taken, maybe your vital sign is being taken like a strand of broom out of a bunch. They are seeing the whole bunch and taking, informed decisions based on what they can see, the holistic you. That's the intervention that we make, and this makes it possible. If it were to be paper, some might be dog-eared, others might be torn, you understand? Others are lost. Even if you strap them together using a string, there is still the possibility that some of them might still detach. A folder might be in the doctor's office or in the theater, and it's forgotten there because the doctor wants to use it, and the doctor is transferred. Then the patient loses that folder. But for this, no. And it also gives room for monitoring. What you are imputing here, if my CEO wants an input on a particular patient, or my MD, or my HOCS, right in the comfort of their own offices, they can open the platform, look at what is going on at the OPD, look at what is going on the board, and if they have an input there, they can make it. If they have a correction, they can call you and tell you or give you an input from there, without them necessarily having to come in person or to request folder, which might be a format in their office. A folder that has gone around on the ward, and now you bring it into somebody's office in this age of COVID. But with this, The folders are off, you can just do this. And when you come in the morning, you can easily just sanitize the keypads. You are the only one who's using it. And you can make input from their own offices. So I really recommend it.
Wow. Okay, good morning, sir.
Good morning.
I understand that you're the ICT officer, like the manager of this hospital. So I have just a few questions for you. Okay. We're here to understand how ICT has been positively effective in the health sector. So my question to you this morning is, given the fact that electricity supply is not stable in Nigeria, what measures have you put, like the hospital have put in place to ensure that ICT is reliable and rendering of services is not tampered and that your data is always secured?
Okay. My name is Raphael Oguche. As you rightly said, I'm the ICT officer of Madonna Hospital. The thing about electricity and ICT, electricity and communication, when you talk about cell phones, computers, and data management and data systems as a whole, is you cannot really underestimate the impact of electricity. But here in Madonna Hospital, ICT had really helped in organizing our process, you know, in terms of data management, data structure, and patient waiting time. These were issues that were put into consideration before we delve into digitizing the whole hospital. As it stands, we don't do anything with patients on paper. Everything is on computer. And what it means is that you do not pay for what you're not given, and you won't go if you don't pay for what you're given. What that means is ICT had succeeded in curbing the argument between patients and hospital management in terms of billing. ICT had succeeded in also curbing the problem of waiting endlessly. We talk about the QA system, the first in, first out system, which is supposed to be what is done in a hospital except for emergencies. The system puts people as they come. So once an appointment is booked for you, if you had come first, you're going to be number one on the queue. What it means is that you're going to be the first to be attended to. This is only bypassed when there is an emergency. We all understand what that means. So the corruption in terms of the activities of the hospital, for example, patients manipulating people, you know, to be first attended to, and all of that is not possible with the system on ground. And a secure data system is in place. What that means is that, I'll give you an instance. When we're doing the manual system, a patient comes to the hospital and probably the file may have gone somewhere different, maybe for purposes of clarifications and all that, and then people will have to practically search for the file, and if this file is not found, it will be difficult to begin to attend to the patient. There are cases that you may not even find it at all, maybe for that day, and see it much later. But with this in place, with the EMR in place, you come and you say, my name is Raphael Oguche, and then they type Raphael and type Oguche, and it brings out your name. Or you say, my name is 005, my numbers rather is 005, and then 005 is imputed. It brings up your name straight ahead. Now, look at the time it will take someone to present a number, the time it will take the officer to go to the shelf and sort that number, the time it will take the officer to come back to the table and impute what is necessary on that card, and the time it will take that officer to walk from the office to where the card is submitted for vitals. Now you come to me, you give me your number, I query the number, your name comes out, I book an appointment, and you start. So, timing and accuracy and data security is what ICT had brought. Now, coming to the second question of how we are able to sustain our activity, given that there's a lot of instability when it comes to electricity. The hospital had made arrangements that has been in place even before now for power backup. There is a mechano generator that is for central power backup, and then for sections there are solar inverters that are backing up every system in this hospital, from the server to every workstation you see. So there is no time that we are going to be completely out of power. Our inverters can actually last for 48 hours without external supply. And when there is no external supply, we can actually revert back to the generator and then power them again. So the electricity situation does not hamper the activity. And also you talk about data security. I think that is what you said. Yeah, our data is secured. We have backup systems. And this is an activity that we do from time to time. So we do not have the fear of losing data at any given point in time because of the backup systems that are in place.
I see a machine behind you. I don't know, can you educate us more about what it is and what it's used for?
Oh, okay. What you see here is an equipment rack. It's just like, okay, to break it down to a level which you will understand it, you would see it as a cupboard, all right, where many things can be kept. So most of the network hardwares are housed in that rack. So the switch, the patch panel, and the router are all in the rack. So it's just like the beginning point of the hospital network.
The use of ICTs has the potential to promote patient-centered healthcare at a lower cost, improve quality of healthcare and information sharing, educate health professionals and patients, encourage a new form of relationship between patients and their health providers, reduce travel time, etc., etc.
Good morning, sir.
Good morning.
May we know you, please?
My name is Tony Ochai. I'm the head of the lab.
Okay. Nice meeting you, sir.
Thank you.
Okay, I'm here to ask a couple of questions like, how has the use of ICT been beneficial to your department in the hospital?
Well, ICT is of benefit to us in the sense that it makes the work easier and faster for us. When a doctor makes his request, we get the request immediately on our platform without the patient necessarily coming with the request form. And when the test is done, the result is sent to the doctor via the same process, making it easier. And it makes the work paperless. You don't allow patients to go about carrying papers and all of that.
Okay, so I have another question for you. What problems do you encounter using this platform?
One of the challenges is at times it can be slow, especially when the network is bad or when the network is poor. You have it is slow. I think that is the major challenge that we have.
Okay, so what will you prefer to be done differently?
Well, improvement on that network so that the work can be faster.
Okay, so what is your recommendation to the public on this particular topic?
I advise that everybody should go on ICT. At least it will make the work faster, and the issue of having bulky files for storage will also be minimized. Because of the use of the ICT, you have your data stored in the system. And in terms of accessibility, it is very easy to access patient information. Unlike when you are using papers and folders, you have to go searching for the information. So my advice is that the public should go on ICT, where the work is much easier.
Okay, sir. So would love to see, if it's possible, to see some of the machines just few of the machines that are being used in the lab.
Well, I'll start from this place. Okay. This is a ECG machine. That is electrocardiogram.
What is it used for?
Okay, it's used to check, using electromagnetic wave to check the wavelength of the heart. That's you're using the machine now to check using electric current to check the wave of the heart. That's why it's called ECG, electrocardiogram. Hematology analyzer, one of the machines used in the lab. This is a backup of this. This is chemistry analyzer. It is used for chemistry tests. That is chemical pathology. You can use it for liver function tests, lipid profile, and all of that. This is another chemistry analyzer. This is the name, Selectra. It's also used for chemical pathology. Use it for liver function tests, kidney function tests, calcium, and all the other tests. This is for CD4. The name is Cyflow Counter 1. This is for measuring CD4. Then the name is Clover. You can use it to measure glycated hemoglobin. You can use it to measure glucose level in the body. And this is for hormonal assay. The name of the machine is iChroma. You can use it to measure the different hormones in the body, either growth hormone or reproduction hormone, like prolactin, progesterone, follicle stimulating hormone, and the rest of them.
Good morning, ma.
Good morning.
Please,
You're welcome.
May I know you? May we get to know you?
Yeah, my name is Agada Mary.
Okay.
I'm the head of department for pharmacy from Madonna.
Alright, we're here from Benue State University. We're just here with a couple of questions to ask you.
Okay.
So, my first question to you today is, what will you consider to be better, your former way of attending to patients or the current ICT way of attending to patients?
That's an obvious answer, I'm sure you. Well, the system-based is best.
Okay, so if that is best, what are your reasons?
It's faster. We used to use the paper method.
Okay.
Yeah. It was, patient waiting time was a lot, was so much, so we had to bring in the computer-based. It's faster, it reduces patient waiting time. It's more, it helps us with our documentations. The paper method, there were so many losses we're having with patients' documents and records. With the ICT, everything is there. There's no loss and all that. And then the procedure for treatments, for dispensing of drugs, everything is just automatic. So at the end of the day, we all enjoy ourselves while working.
All right, thank you very, very much. Do you have any recommendation to the public or other sectors as to which to use?
Yeah, well, which is better? The computer-based is better. In everything you do, in every method, there are disadvantages, there are advantages. I'm not saying that there are no disadvantages. Like, it's possible that lights can just strip off and all that, but the advantages outweighs the disadvantages. is the best. Like, you can always go to an ICT expert to ask questions. It's the best. Personally, I would tell you that everybody should go into this.
Okay.
Yeah.
Thank you very much for your time. It's nice talking to you, Miss Mary.
Thank you.
We really do appreciate it.
Yeah,
Have
you're
a
welcome.
Nice day.
Thank you. You too.
Bye. Good morning, ma. We are students from Benue State University, Makurdi, Department of Mass Communication specifically. We are here to just ask you a few questions about ICT, but before then, may we get to know you, ma?
Okay, you're welcome.
Thank you, ma.
I'm Mrs. Veronica Kanyi. I'm the head of clinical services here in Madonna, head of nursing services.
Okay. Ma, our questions to you this morning, one of it is, considering the former method of attending to patients using paper sheets and pen, and the current ICT method of attending to patients, which do you prefer and why?
I prefer the ICT.
Okay.
Like, it saves time, it's more accurate and fast. The documents are well saved. Unlike the paperwork before, a paper can flip up. Sometimes they lock the office, but this one is easily accessed. And the billing also, you don't have to wait until you call somebody to come and bill. So everything has been programmed. So once you clicked in on what you have done on a patient, automatically the bill has been made. So it saves time.
Okay, ma. Are there any challenges?
Yes, like you all know that the power failure in our country. So we are still fighting on that, because since we are using this method, it means that 24 hours they have to be light. So we are really trying on that. Buying of diesel has not been easy, but the MD has implanted inverters to save us also. We are still fighting on that. Sometimes it goes off, and that has been the major challenge for now.
Okay. So what would you recommend to the public and other health sectors in the country?
I will advise them to go on the same method, because it's very safe, easier. You move about, you don't need to carry folders, booklets, and there you just need, like here where my nurses are serving drugs, you just have to go with the iPad, and each time they are easily accessed, and it also make you look smarter and beautiful, because some patients, they admire it, that you are operating like American nurses and all those things. So all this paperwork, if it is paper, you have to go around carrying files and all those things, and it's bulky. So but all this one, everything goes with an iPad. You can access everybody.
Thank you all for staying tuned. I hope you had a great time. See you some other time. Bye for now.